America is not collapsing loudly. There are no sirens. No single breaking headline. No dramatic moment of failure. Instead, something slower is unfolding. Across the country, millions of Americans wake up already tired, not because they stayed up too late, but because rest no longer restores them. They move from alarm clock to traffic jam, from inbox to meeting, from shift to shift, carrying a fatigue that never fully lifts. This is not laziness. This is not weakness. This is burnout. Today, burnout has become one of the most powerful, and least discussed, forces shaping American life. When burnout stopped being personal. For years, burnout was treated as a personal issue. If you felt overwhelmed, the solution was simple: meditate, exercise more, improve time management, build resilience. But modern research tells a different story. According to Gallup's 2024 and 2025 workplace reports, a growing share of American workers report feeling stressed, emotionally drained, and disengaged every single day. Employee engagement in the United States has fallen to levels not seen in years. The American Psychological Association, in its most recent Stress in America surveys, confirms that chronic work-related stress is now the dominant psychological burden for U.S. adults. This shift is critical. Burnout is no longer concentrated among a few high-pressure professions. It is widespread, systemic, normalized. Burnout is no longer about individuals failing to cope. It is about systems designed without recovery. The science of exhaustion. Burnout is not just feeling tired. The World Health Organization officially classifies burnout as an occupational phenomenon, characterized by emotional exhaustion, cynicism or detachment, and reduced professional efficacy. Neurological studies cited by Harvard Medical School show that prolonged stress alters how the brain regulates motivation, memory, and emotional control. This means burnout physically reshapes how people think and feel. Over time, the brain remains stuck in a state of alert, even during rest. Sleep no longer repairs. Time off no longer refreshes. The body never fully powers down. This is why burnout lingers, and why it spreads. The economic price of a tired nation. Burnout is often framed as a mental health issue, but its largest consequences may be economic. Research referenced by Harvard Business Review, McKinsey, and the Centers for Disease Control and Prevention estimates that burnout-related absenteeism, turnover, healthcare costs, and lost productivity cost the U.S. economy hundreds of billions of dollars every year. Burned-out workers are more likely to quit, more likely to make costly mistakes, more likely to require medical treatment, and less likely to innovate. The U.S. Bureau of Labor Statistics shows rising voluntary quits alongside declining workforce participation, a sign that many workers are not just changing jobs but stepping away entirely. Burnout doesn't crash the economy. It quietly drains it. Working more, producing less. America works harder than almost any other developed nation. According to OECD data, U.S. workers log more annual hours than their counterparts in most high-income countries. Yet productivity growth has slowed. Reports from Deloitte and McKinsey Global Institute show that excessive workloads eventually reduce efficiency. Long hours lead to cognitive overload, slower decision-making, and higher error rates. Burnout doesn't create excellence. It creates diminishing returns. The American economy is asking for endurance from systems that require creativity. When stress becomes illness, burnout does not stay at the office. The CDC links chronic workplace stress to cardiovascular disease, depression and anxiety, sleep disorders, and weakened immune response. Healthcare utilization data shows rising stress-related diagnoses, especially among working-age adults. The National Institute for Occupational Safety and Health reports that burned-out workers face higher injury rates and longer recovery times. America's healthcare system is increasingly treating conditions created by its work culture. Burnout is not just emotional. It is physiological. Who bears the heaviest burden? Burnout does not affect all Americans equally. Data from the Federal Reserve's Survey of Household Economics and Decision-Making shows that workers living paycheck to paycheck experience significantly higher stress levels. Pew Research Center identifies especially high burnout among healthcare workers, educators, service and warehouse workers, and gig economy and contract labor. These workers often lack predictable schedules, paid leave, and long-term security. For them, burnout is not temporary. It is structural. A generation entering life already exhausted. Perhaps the most troubling signal comes from younger Americans. According to Gallup's Gen Z workforce data, young workers report burnout at higher rates than older generations, often within the first years of employment. The CDC's youth mental health statistics show rising anxiety, depression, and stress even before full-time careers begin. This means the next generation is entering adulthood already depleted. Burnout is no longer a midlife crisis. It is a starting condition. The failure of corporate wellness. In response, corporations have acted. They introduced wellness apps, mindfulness training, and mental health webinars. But research from McKinsey and Harvard Business Review shows these interventions fail when underlying conditions remain unchanged. Burnout cannot be solved while workloads increase, wages stagnate, and control decreases. Wellness without reform becomes performance theater. It treats symptoms, not causes. Why America is uniquely vulnerable. International comparisons reveal a stark contrast. OECD nations with guaranteed paid leave, shorter workweeks, and stronger labor protections consistently report lower burnout rates. America's exhaustion is not inevitable. It is a design choice. Policy, culture, and economics intersect to reward constant output and punish rest. The future if nothing changes. If burnout continues unchecked, the long-term consequences are severe: lower labor participation, rising healthcare costs, reduced innovation, and weakened trust in institutions. Even automation and AI may intensify pressure, demanding constant upskilling without security. Burnout threatens not just productivity. It threatens social stability. Closing. Burnout is not a moral failure. It is a warning. A warning that a society built on relentless pressure cannot sustain human well-being. America does not lack ambition. It lacks recovery. The question is no longer whether burnout exists. The question is whether the nation will listen, before exhaustion becomes permanent.